So thanks. Before I was saying that today, now here is 2 o'clock p.m. So you can say good afternoon to me. One moment, that is is a good. Now I start sharing in a few seconds. Allora, share screen, this one, and then one. Okay. Okay, so nice to meet you, and I am Dr. Edoardo Bianco. Very pleased to meet you, and I am here today to speak about the assessment of electromyographic changes in patients with masseter hypertrophy and muscle pain after botulinum injections. I am a doctor from Italy. I work in Hospital San Gerardo in Monza, and I also do research for University of Milano Bicocca. So at first, I have to introduce the first main character of this study, which is the electromyograph. The electromyograph is a device, a completely wireless device with 4 probes that can that can put into the 2 temporalis muscles and the 2 masseter muscles. And it allows measurement of the occlusal balance, muscle recruitment, asymmetry, and we can do comparative analysis over time. And it is a very reliable device. In fact, a study from De Felicio et al. Showed that there were no statistically significant difference also after 6-month interval in the same person analyzed with the same tool, of course. Then, since we are speaking about bruxism and Botox, botulinum toxin, which is also called Botox, we have to introduce those 2 words. Botox is a toxin that inhibits the release of acetylcholine. So it inhibits the muscle contraction, preventing the contraction, especially when the contraction is too high or considered pathological, like it happens in the patient with bruxism. And the latest study about Botox, about botulinum toxin, one of the latest and one of the best projected, says that it can be used in bruxism in patients that do not benefit from conservative treatment. Conservative treatment is, for example, physiotherapy or occlusal splint. And bruxism is a repetitive jaw muscle activity characterized by clenching or grinding of the teeth, or also bracing or thrusting the mandible. So we can introduce our research. We analyzed 6 patients. All of them were female, between 27 and 54 years old. All of them had unilateral or bilateral masseter pain or contracture, masseter hypertrophy, which means an increase in the volume of the muscle, and all of them were diagnosed with nocturnal bruxism, according to the American Academy of Sleep Medicine. So, as I said before, they were analyzed with the electromyograph. The pain that they felt in the muscle area were diagnosed according to the diagnostic criteria of temporomandibular disorders. And also the muscle hypertrophy was photographed and marked. So during time we could notice the eventual decrease in the size. But I have to say that at first, before analyzing the 6 patients, we did a first case report, just analyzing 1 patient with a 5-month follow-up. And it showed a promising result. How, as we can see from the graph, we can see that it is represented with the lines, with the colored lines, the electrical activity of the muscles measured in micron volt per second. So we can see that the electrical activity of the muscles, which is the same thing of the strength of the contraction, was very high at the beginning. Then we see sudden and very big decrease in the activity. 6 patients with the inclusion criteria that I said before. The protocol applied for the first patient we analyzed before was the same protocol we applied for all of the other patients, so 54 spywood units, and then 2 weeks later, added 24 spywood units. But then, as we can see in the graphic, the time during when the patients were analyzed was longer. We see, as we've seen before, a drop in the electrical activity from T0 to T3. Then the muscle strength, the electrical activity continues to slightly increase, but then to prevent other increase and to prevent the recurrence of pain, we did a second injection of Botox, which is called a retouch. It was performed in different ways. For example, we could also modulate the dose in the left or the right masseter because we wanted the best symmetry possible for the face of the patient. But then what we can see is that there is also a very hard reduction in the electrical activity, which slowly increases again. So I have to see another thing. The 4 lines that you see represents the electrical activity of the masseters, both left and right, and both on cotton rolls and clenching on teeth, because this is the protocol that the electromyograph I use is projected to do. So to have two different tests, we do it on cotton rolls and on teeth. But the result was the same. Even on cotton rolls, even on teeth, we noticed a decrease, then a slightly increase, and then again a very sharp decrease, and also again slight again increase during time. So we can add a photo to our study. Since I projected the photos of this patient before, we can continue with her. After the second injection of Botox, so after what is called the retouch, as I said before, we can see again that the masseter that were more or less slightly increasing again in volume. So the hypertrophy was returning. We can see in the last photo that the profile, the shape of the face is very sweet, is very nice and very round shaped, not square shaped like it was at the beginning. So we can take some conclusions, such as the Botox injection is effective in reducing muscle hypertrophy, and this result is aesthetically visible, as we can see for the photos, and also recorded with surface electromyograph, which is very important to assess that what we are doing is done well. So muscle hypertrophy after the second injection, so after the retouch, did not even recur in this patient. Of course, protocols have to be drawn up because in literature we cannot find a protocol on what to do with Botox in bruxism or Botox in squared face shape. But we have to decide what to do and to set up some protocol because we noticed that the first time and also the second time the pain recurred at 5 months, while the muscle hypertrophy did not recur after the second injection, pain did. So is it possible that those kind of treatment should be repeated every 6 months for consecutive 2 or 3 years before having stable benefit? Of course, this is a research with just 6 patients because we started it last year. In Italy, the use of Botox for aesthetic medicine and bruxism was developed very recently. But this is why we found this very useful practice, this very useful treatment. We found that it is now very important to draw guidelines, to draw protocols to allow every dentist who works in aesthetic medicine to treat patients with bruxism in a very effective way, in a very simple way, even if maybe this treatment could be repeated in time if needed. So, to conclude this presentation, I can say thank you to you all for the invitation at this Congress. Thank you for introducing me, and I'm very sorry not to be in Dubai now, but it will surely happen the next time. But for familiar problems, I couldn't be there. But thanks a lot, and I hope to see you soon, not from a video, but live. Okay.
But how can you correct, besides that kind of correction for bruxism, right, the hypertrophy, is there another way?
Another way for what?
Yeah.
I didn't understand. Another way to obtain...
To prevent this, not prevent, you know, like, how do you say that?
To treat bruxism?
Well,
to control, the way I think control, because bruxism is that like grinding of the teeth, right?
Yes, yes.
Yeah, so
how do you... There are really a lot of other typology of treatment. For example, in the occlusal splint is probably the most frequent way in which dentists treat bruxism. Also, physiotherapy or low-level laser therapy can be used. Also, a treatment with drugs. But the problem is that when a patient have a very strong and thick masseters, it is not easy to reduce his pain, because he does a very strong power with that muscles that are hypertrophy. So another possible way is the surgery of the masseters to reduce the volume, but the literature really is not so favorable to the surgery of the masseter muscles, because it can leave some scars which can be harmful. So Botox is a way that can both treat the symptoms such as pain, but also the aesthetic of the shape of the face.
Dr. Bianco, I have a question. Can you hear me?
Yes.
Okay. If they've, because I had that procedure done. I had Botox injections for bruxism about 6 months ago. But I was told that there is a possibility that after 6 months or even a year, I need to go through orthodontic treatment as a follow-up. Is that a better option than surgery? And what do you think about that?
Yes, I think that every option could be better than surgery, especially because surgery is very invasive. So I think that the surgery should be the last thing to do and to think about. For now, what can I answer you is that since there are not so many adverse effects of Botox, I think we can do it even every 6 or 7 months, because it doesn't have a lot of adverse or side effects. So even if some of my patients need it every 8 or 9 or 12 months, it is good because it is a very non-invasive procedure. And I see that all of the patients are very happy for the reduction of pain, which is quite immediate. I
Thank
hope
you.
that I answered your question.
Yes, you did. Thank you.
Thanks to you. Okay,